Is it safe for men over 70 to masturbate? What does science say, and could it even be good for your health? Well, get ready, because today we're diving deep into a topic that's often whispered about, yet scientifically fascinating. If you're over 70 or care about healthy aging, this one is especially for you. Let's break the myths, reveal the data, and understand the real impact of masturbation in older men. You might be surprised by what we found. Let's begin with a simple question. Is masturbation harmful for men aged 70 and above? Do men over 70 still feel the desire to masturbate? How does aging affect sexual function and health? And what about heart health? Is it safe? I dug through the latest research, and here's what science reveals. As we age, every system in the body gradually slows down, and that includes our sexual function. However, that doesn't mean it disappears. A 2010 US national survey of over 5,800 individuals aged 14 to 94 found that 27.9% of men over 70 had masturbated in the last month and 46.4% in the past year. For comparison, in the 25 to 29 age group, those numbers were 68.6% and 83.6% respectively. Yes, there's a decline, but it's not a disappearance. A 2021 Norwegian study involving over 4,100 adults showed that among 342 men over 70, 22.5% reported masturbating in the past month, similar to the US data. Interestingly, younger men under 30 were less active in this study. Why? It may be due to relationship dynamics, stress, or lifestyle, an area still being researched. Okay, so sexual desire doesn't vanish overnight. According to a 2020 meta-analysis published in European Urology Focus, including 75 studies, sexual interest among men aged 70 plus varied widely, from 16% to 80%. 3. That's a huge range, showing individual differences matter more than age alone. On the other hand, erectile function naturally declines with age. The same study found that 8% to 94% of men 70 and above reported some level of erectile dysfunction, ED. Despite that, here's the key takeaway. Erection is not a requirement for orgasm. Yes, it's absolutely possible to orgasm even without a full erection. That's something many men, and even doctors, aren't fully aware of. So, why do older men masturbate? Well, you may assume masturbation is purely about sexual satisfaction, but research says otherwise. A study of nearly 3,000 men found that many masturbate for stress relief, to manage anxiety, or to help them fall asleep. In other words, it can serve emotional and psychological functions, not just physical ones. The Norwegian study also noted a weak correlation between masturbation frequency and sexual satisfaction. That suggests masturbation may be more about comfort, routine, or mood regulation than about libido alone. As the saying goes, use it or lose it. This applies to sexual function too. Men who remain sexually active, even just through masturbation, tend to maintain better erectile and orgasmic function over time. In contrast, complete sexual inactivity can lead to irreversible changes in penile tissue and nerve function. Once those changes set in, they can be difficult or impossible to reverse. Many older men who reconnect with intimacy later in life via dating apps or new relationships often experience challenges, not because of age alone, but because of years of inactivity. So, is it safe for the heart? Well, you may wonder, is it safe for older men to engage in sexual activity or masturbation, especially with existing heart concerns? Good news, sexual activity, including masturbation, is generally safe for most older adults. However, if you have heart disease or other medical conditions, always consult your doctor before making any assumptions. As the American Heart Association suggests, if you can comfortably climb 2 flights of stairs, you're likely healthy enough for sex. And that includes solo sex. Okay, so what's the bottom line? Masturbation is not harmful to men aged 70 and above. For many, it supports mental well-being, emotional health, and even physical function. Sexual desire varies greatly among individuals. Age is just one piece of the puzzle. Staying sexually active, even through masturbation, may help preserve function as you age. And remember, not feeling the need to masturbate is just as normal. It's about what feels right for you.